Hello everyone, we're Group 5 and today we will be presenting on syphilis among pregnant women in the United States. My name is Brenda Toscano and my group members are April Ceja and Lizeth Galvin. Syphilis is a bacterial infection that usually spreads by oral, anal, or vaginal contact. Syphilis is a sexually transmitted infection that can cause serious health problems. Syphilis is caused by the bacterium Treponema pallidum. The bacteria enters your body through minor cuts or is absorbed into your skin or mucous membrane. A person can become infected by having unprotected sex with an infected person. It can also be passed down from an infected mother to her unborn baby during pregnancy. In 2017, over 30,000 cases of syphilis were reported in the United States alone. More than 9 million women in the United States are diagnosed with STIs each year. While STIs like syphilis are easy to treat through medication, if left untreated, they can lead to chronic diseases and serious health problems. For instance, reproductive health problems or fetal and prenatal health problems. Health education and interventions are crucial to helping reduce the spread of syphilis and encouraging treatment. Ending negative stigmas against STIs can help us move forward into normalizing STI testing among populations who are most vulnerable. Morbidity rates of syphilis in the United States have increased in recent years. In 2018, over 35,000 cases of primary and secondary syphilis were reported. According to the Centers for Disease Control and Prevention, the highest rates of mortality due to syphilis were observed in mother-to-child transmission. Syphilis increases the chances of stillbirth, prenatal death, unintended abortion. Being pregnant does not protect you from syphilis. Syphilis is extremely serious for unborn babies. Syphilis and other STIs have a great economic impact on the U.S. healthcare system. In 2016, an estimate of $16 billion was spent to help treat new cases of syphilis and other related STIs. Through the use of surveillance and other epidemiological resources, we can observe the threat that syphilis poses to pregnant mothers. Cases of congenital syphilis have nearly doubled in the last 5 years, therefore increasing the number of stillbirths and infant deaths in the United States. Many pregnant mothers do not know they are infected with syphilis until weeks later when physical symptoms appear. This is because they can remain asymptomatic for weeks. This is where it becomes harder to detect women who are infected and encourage treatment and early prevention. Symptoms are typically divided into 4 phases. The first is primary. During the primary phase, painless sores appear on genitals, mouth, anus, or rectum. These sores typically last anywhere from 3 to 6 weeks. The next phase is secondary. During this phase, rashes on hands and feet appear. These rashes are often red or brown and do not itch. This is followed by a latent phase. During the latent phase, no physical symptoms are typically present, but the infection can typically be detected through blood work conducted by a medical doctor. Lastly, the tertiary stage is where chronic illnesses are often detected. This is where an individual who is infected can oftentimes have difficulty moving their arms, legs, hands, and this can furthermore lead to paralysis, numbness, blindness, and even heart disease. This illustration depicts 3 out of the 4 stages of syphilis, excluding the latent phase. The first stage is the primary stage, where sores appear for a couple of weeks, followed by the second stage, if left untreated, where brown or red rashes appear throughout the body. Furthermore, the last stage would be the tertiary stage, demonstrated by stage 3. This is where no medication has been administered and can damage internal organs or lead to things like paralysis or even heart disease on the more chronic cases.
Hi, my name is April, and I'm going to go ahead and talk a little bit about syphilis. In regards to its modes of transmission, there are three main ways of getting syphilis. The first one being person to person through direct skin to skin contact, which is through a syphilitic sore known as a chancre. Additionally, the second way would be through unprotected oral, anal, or vaginal sex. While birth control can help protect against pregnancy, the lack of condoms does not protect against any STIs, such as syphilis. And the third way would be from mother to infant. If a mother has syphilis and is expecting, there's a high possibility of her transmitting that syphilis to her child when that child is born. While syphilis is fairly common and can be easily transmitted, there are ways in which we can protect ourselves by preventing, which, as we have learned in class, it's providing ways in which one can prevent the incidence of a disease, in this case, syphilis, with the implementation of all three levels of prevention. So, for primary prevention, actively the use of condoms during any sex, whether it is anal, oral, or vaginal sex, can help protect against syphilis. Passively abstaining from all sexual contact can also prevent syphilis. For secondary prevention, getting tested quickly after having unprotected sex can help syphilis from becoming even more severe than what it is. Getting treatment, of course, and also avoiding any sexual contact until one is completely treated and cured. Additionally, screening for pregnant women with syphilis can help prevent syphilis among their children and their future children as well. For tertiary prevention, one can go years with syphilis and experience absolutely no symptoms. So, getting treatment as soon as finding out can go a long way. So, when it comes to age, while syphilis does occur among all age groups, it's actually fairly common among younger people. While in 2017 to 2018, rates did increase in all age groups among those of 15 or older. In 2018, they found that rates were actually much more higher among those 25 to 29. Regarding race, throughout the years 2014 to 2018, rates did increase among all race Hispanic ethnicity groups, yet in 2018, cases were much more higher among blacks than any other group. In addition to that, throughout the years 2017 to 2019, they found that there was a significantly high increase among American Indians and Alaskan Natives. So if we take a look at the chart on the right, you can see that blacks had a significantly high rates of syphilis compared to any other group. And if you take a look at the black line, which represents American Indians and Alaskan Natives, there was that significantly high increase of syphilis within the years 2017 to 2019. Sex and sexual behavior is also another host factor when it comes to syphilis, where in 2018, syphilis rates were much more higher in men compared to women. Additionally, most U.S. syphilis cases were among gay, bisexual, and MSM, which stands for men who have sex with men. Throughout the years 2017 to 2018, they found that 64% of cases were among men who have sex with men. Now, in connection to that, if you look at the chart on the right, you can see that when we're comparing men who have sex with men to men who have sex with women and women in general, syphilis rates are significantly much more higher among men who have sex with men compared to any other group, which just shows how much of a risk men who have sex with men are when it comes to syphilis. There are many environmental factors that put many people at risk, such as geographic location, where distribution differs from country to country. Additionally, less than 25% of women in low and middle income countries are not getting prenatal care, which means that these women are at a greater risk of not knowing whether they have syphilis and possibly transmitting it to their babies, which is all due to the lack of testing and treatment that they are not receiving. While high income countries are experiencing epidemic rates in their specific populations, such as men who have sex with men and pregnant women, low and middle income countries are experiencing endemic rates in their general population. Whereas we learned in class, endemic is when a disease or condition is found among certain populations or areas, which puts individuals living in low and middle income countries at a risk. In regards to social and economic factors, many low income communities have very poor access to healthcare due to stigma and discrimination. Most of these individuals might be too afraid or might feel judged, which puts them at a risk of not getting tested and living with syphilis, which can ultimately negatively affect their life. Lastly, education. Unfortunately, not everyone receives a proper education, especially when it comes to sex education. People live lives not knowing how to prevent, let alone how to properly use a condom, which increases the risk of not just syphilis, but other diseases or conditions. With the proper sex education, we can go a long way in reducing the rates of syphilis and promoting a long, healthy life.
Hello, my name is Lizette, and I'm going to be talking about the temporal variations in syphilis. In 2017-2018, there was a 36% increase in congenital syphilis. This was being addressed at the time because of the nation's STD epidemic, which was syphilis. Epidemic, which is described in the book as an occurrence of an infectious disease in a community at a particular time. Some examples of these can be smallpox, scarlet fever, Spanish flu, or just our average flu season, which happens at the same season of the year. Some trends seen in syphilis are: syphilis first began rising in the 2000s, with most cases being in men who have sex with men, not congenital syphilis, as stated in 2017-2018. Or syphilis continuing to rise by 40% if there isn't proper care or action provided. And there has been an increase in heroin/meth users contracting syphilis because of same needle usage, or drug use can lead to risky behaviors or trading sex for drugs. The knowledge gaps. Insufficient knowledge within a community. An example would be many low income neighborhoods are cutting back funds available for health education and health care. This results in the funds being cut back towards sex education, which covers the topics of basic STD knowledge. Or many people in low income neighborhoods don't have access to proper health care, which results the lack of community level knowledge, which leads to poor recognition of early signs and symptoms of syphilis. This chart on the left, titled Syphilis in Newborns is on the Rise in the U.S., shows how congenital syphilis has nearly tripled in the past 5 years. In 2014, there was about 462 cases of congenital syphilis. By 2018, there was 1,306 cases of congenital syphilis, nearly tripling in the past 5 years. This advocacy poster on the right, titled Syphilis Testing is Essential for All Pregnant Women, states how one test may not be enough, so we should start testing early and if needed, to help catch early on cases of congenital syphilis. This slide focuses on some further epidemiological research that should be done. Since there are ways to make syphilis preventable and curable when one has common knowledge on the disease and when it's caught early on, could this help put an end to syphilis? Epidemiologists can also discuss why syphilis rates are higher in some states compared to others. Could it be because of lack of healthcare access? When one is showing common symptoms of syphilis, they should seek medical treatment, even if it's not causing them discomfort at the time. And what caused syphilis to rise again since it was nearly eliminated years ago? Could it be because of lack of knowledge on the disease and how to take care of themselves? Group deserve $100 million towards research? 1. We can provide better healthcare access and health education to SES income communities. 2. We can provide services at little to no cost and help increase the background knowledge on not only syphilis but other STDs as well. 3. Since congenital syphilis is on the rise, providing quality and affordable health services to pregnant women who don't have access to health care, we can help catch it early on and help them get it cured.